Hello and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. Our program today is about coronary artery disease and heart attack, and joining us for this important discussion is board-certified interventional cardiologist B. Ramesh Reddy. Dr. Reddy, welcome back to Today's Health.
Thank you, Barb. Glad to be here.
And it's always important to update us on this and remind us about what is coronary artery disease.
Well, coronary artery disease, as the picture here kind of points out, this is a disease that involves the arteries that are supplying the heart muscle. You have one artery here on the right side and one on the left side. So when these arteries develop blockages over time, then you call this as a coronary artery disease. And the blockages tend to obstruct the blood flow, causing a decrease in blood flow to the heart muscle. And this slide depicts very clearly how the blockage develops, this yellow cheesy material that impedes the blood flow to the heart muscle, and that causes chest pain, and if it's totally blocked, it causes a heart attack.
What causes coronary artery disease then?
No, there are a number of causes for that, but the exact trigger why one has this blockage and the other person does not is not totally clear. Having said that, we know a number of factors that seem to be responsible for causing coronary disease in people. Those who have diabetes, for example, the risk of heart disease is high. That is, the risk of developing a blockage like this is high. Those who have high blood pressure, those who smoke, those who have a very high cholesterol, a very sedentary lifestyle, all these situations make it more likely to have blockages. So it's really a buildup of plaque, and on top of the plaque, when you have a rupture of that plaque, a clot forms and blocks off the artery. So that is the sequence of events. But what is the actual trigger that initiates everything is unknown. Some people feel it could be an inflammation, so that's also a possibility. So these are the factors that cause the heart disease.
Because is it true that some people really don't have very much coronary artery disease and other people have quite a bit more?
Those who have those who are more likely to have blockages or heart disease or obstructive coronary artery disease are the ones who have high blood pressure, diabetes, those who smoke.
Okay.
Those are the kind of individuals. Those who don't have are really the more active ones. It's not to say that they will never have it, but they are less likely to have it. Those who are more active, who are able to keep their cholesterol down, who do not smoke, and who don't have high blood pressure or diabetes.
At what age does this disease start?
When does the fatty buildup in an artery starts? It happens at a very young age. We have data to support that, but at what age does the disease manifest itself? Meaning, when does it raise its head and show up as a problem? Typically in men over 45, women over 55, we see the disease, but the actual process starts much earlier in life.
So these things that you've talked to us about, because coronary artery disease puts you at risk for heart attack, so lowering those risks lowers your risk for heart attack. Is that true?
Absolutely. There are a number of risk factors which we call them as modifiable risk factors, like controlling your blood pressure, stopping smoking, controlling diabetes, getting into a more of an active lifestyle with exercise. Those are the things you can do to reduce the chance of you having a heart disease. Interestingly, if you have heart disease and observe the things I just said, you will even prevent from having progression of the disease as well.
Are you able to diagnose coronary artery disease before a person has a heart attack?
Yes, we have a number of modalities to do that. One would be a simple a stress test, which your primary care physician can order or a cardiologist could order. Stress test has the ability to detect the heart disease before it actually shows up. And we call that as a screening stress test, which we recommend for people with intermediate risk so that we can catch the disease process early. And there is a calcium scoring, a CT scan, CT angiography. There are a number of modalities, but I'm sure your primary doctor can go over that with you.
So if you have some of these risks, it's important to know your numbers and be under medical care if you are at risk for coronary artery disease.
The couple of risks that you already have is a family history, which you can't modify, but if you have other risk factors, then there is a way to stratify what is your risk. If you are in the intermediate risk category, that is a 10 to 20% chance of heart attack down the road next 5 to 10 years. That group of patients or people can go on and have certain tests which will put them at a highly likely or less likely for heart disease. And then you can take the appropriate precautions, using medicines to lower the cholesterol level, changing your lifestyle. You can be more aggressive about preventing the progression or onset of disease.
How common are heart attacks?
No, Barb, it's the most common disease that kills men and women. In St. Clair County, Michigan, United States, and probably the world over, that is the commonest killer of both men and women. It's as common as it gets.
Well, you know what I've decided? I'm going to get a picture of a heart, like one of these pictures, and put it on my refrigerator. Because this modifying your risks is something you need to do every day.
I think it's a culture thing. It should start early as children are growing up. Not to say that they shouldn't have any fun in what they eat and play, but active lifestyle starts early. Good eating habits start early at home. If you can initiate that early on, that'll be wonderful.
Great information. We're going to take a break. Be right back.